Hi, welcome to the Careers Unfiltered podcast with Mentoria. You may know your dream job, you may know your dream career, but do you know what goes on behind the scenes in your chosen career path? Have you been able to separate the glamour from the reality in your career? Do you know the good, the bad, and the ugly in your career? Most people walk into their careers without having any idea in terms of what really happens in that career, how to crack success, how to get the right job, how to grow in the career. Don't be those people. Get the ins and outs of your career path through some of the best subject matter experts and industry professionals that Mentoria will bring to you on the Careers Unfiltered podcast.
One of my professors from Georgetown, Dr. Monahan, he would say that public health is like a sandbox. It's like where different kids with their different toys come and play, and then they build a magnificent castle, and so it's very diverse. It's not just limited to one particular disciplinary area. It gives you 6 areas. There are 6 areas which form public health or health as a whole. So, first is service delivery. Service delivery is, let me just give a quick example. It's basically you go to a doctor, you get a procedure done. That's service delivery. Your service being delivered to you. Then there is the health workforce, which are your doctors, your nurses, ophthalmic assistants, perfusion technicians. So the people who actually deliver the service. Apart from that, there are 3 more. There is health information systems, basically the IT component of health. Then there is stewardship and governance. And then finally, there is health financing. So, as a health specialist, as a public health specialist, you find yourself supporting one of these building blocks.
But apart from that, one thing I would like to add here is the public health is that it is changing a lot in recent times. It's expanding a lot now. So earlier, we used to think when health, we would think about, as Meghashish mentioned, there's a treatment, there's a service delivery. So now we are working a lot. One word we use in public health, which has always been there, is a prevention. The public health experts, their role is to prevent something from happening. Apart from that, ensuring service delivery is there. And now the new areas which are expanding a lot is the climate change and health. So climate and health are coming up the new areas. In this one, apart from that, mental health is coming up new ones, because now public health is actually even going beyond the areas which has been defined earlier as per se. So there's more scope, I feel, and more and more experts are being involved. So it's not just public health degree, which I think we'll be talking later on. So it's not just that you have to have a public health degree or you have to be involved in a medical professional. Even environmentalists are coming, horticulturists are coming, agriculture experts are coming. So they all are coming together now. So it's expanding a lot, and I think that's something we won't be even able to summarize in this webinar. Earlier, if it would have been years back, I would have suggested take up science, then do a graduation in some science stream, and then take up a public health degree and come. Now, if you remember what Meghashish mentioned in starting, the 6 pillars. So when you see policy and governance, even an art student can do that. When you go to financing, economics student, commerce student can do that. When in UNICEF, we have engineers who are helping us with our cold chain equipment, who are helping us with those. So those are also public health personnel, engineers with public health expertise. Then we have medical professions like me and Meghashish are here. We did our science, we went to the college, we did our degree, and then we took a public health degree finally. So it has expanded a lot. But if you go by the classic way, the thing is that take bio in 11th, 12th. If you want to go classic, that is, you're very decided that you want to do only health. Then take bio, then take a degree which can be in nursing, it can be MBBS or it can be dental, and then do a master's public health. And I would suggest from a good institute, because recently I have seen some program officers in previous organization also who were not up to the mark. The colleges they were coming from, the public health which they were being taught was I felt wrong. So selecting the institute matters a lot.
I think just looking at things, just like from a clinician's point of view and a public health professional point of view, as a clinician, you're able to provide instant relief to your patient. So, like once I did a filling, once I fixed a tooth, I see the patient smile. That's instant gratification. You feel really nice, you know. But public health is not like that. You will have to work for a lot of years to see the results come. It is something, but there is a good feeling that whatever you build when you're implementation, when you're in the field, whatever you help build, your name won't be there, but like you will create these structures that will be there, which will provide services to the next. You can only imagine how many generations of people to come. If you go to the far flung areas, one particular health outpost has been working since 10, 15 years. So if that is strengthened, that brings a lot of goodwill to the people, good health to the people. But per se, for me, the most challenging time was when I was in Africa and I got malaria. Even though I took my malaria meds, I got a really bad bout of malaria. But then it was, what was reassuring was when I was at the local hospital, the nurse who was injecting the medicines, he basically said that Mother Africa has welcomed you. So, you're now one of us, because he himself had a cannula because he was undergoing malaria treatment. So, just connecting with the people, understanding, that how life is different here, and then how life is different at the front lines. And now that the gears have shifted for me, now I feel more sensitized to like whatever I'm doing at the planning level, because I've seen things at the grassroots. So I think that is a very motivating factor for me.
So I would suggest one thing is definitely patience. Lots of patience has to be there. You're not going to get the results the very next day. Apart from that, I always feel that when you have to be a public person, you can't be individually working. So when you're working as a doctor, as a medical care person, you can work in your own clinic and you can treat your patients and you can have a specific attitude towards them. But when you're working in public health, you have to be a team player, definitely, because otherwise you can't be successful. Apart from that, one thing I always see, which I want in my team, I'll be very specific to what I feel has always been, I wanted that, and I promote it, is that respect for each other. So you will have person who will be working at the lowest level, and you have the person who is working at the highest level. But even that highest person has to respect that lowest level person. You can't work in public health without that. I know corporate sector, the director doesn't even know the name of the person who is working in a team at the most junior level. In public health, you have to know. You have to know the name, because it's all about the team at first, and the mutual respect has to be there. Because it's easy to sit in one office and you're giving orders, but the person who is actually executing the work is working in the field day and night and all kind of weather conditions. So you have to have respect for that person, and that has to start from your day one when you're working. So that mutual respect, team player, lots of patience. And one thing is that good speaking skills, because I have seen sometimes they're amazing at work, but they can't speak well, because you're working with all kind of people. You're working with government offices, you're working private sector, you're working with people in the field, you're communicating actually with everyone. So your communication skills have to be amazing. So those are the 4 or 5 areas I look into the candidate, especially when I'm interviewing. And you do pick up that during the conversation. It's easier to pick up those.
Like I said, so previously a lot of work was focused around universal health coverage. So at that time, a lot of courses had come by WHO, UNICEF. These agencies were like, because that concept of universal health coverage was a very overarching theme, where all of our efforts were towards universal health coverage. But now we see that we find ourselves at the crossroads of pandemic preparedness, and like we're looking at One Health now. Now we're looking at things from a very climate sensitive point of view. We are understanding those intersections of animal health, human health. So, like I said, the priorities keep shifting, the priorities keep changing. So it's imperative that as a public health professional, you are abreast with whatever is happening. And like you mentioned, a lot of these courses do help. And because, like, I'll just give you a quick example. I recently undertook a course which was designed by ICMR. It was on basically One Health and what do we know and where do we go from here. So as we know, there's a lot of like misinformation about the pandemic. There's not a lot of known about the pandemic. Even like in the as a clinician or a practitioner, we don't know some of the goods and the bads of it. So this particular course was designed by ICMR with an aim that whatever body of knowledge we have, it's imparted to the practitioners or the professionals in a systematic 12-week approach. So I feel more confident about my knowledge of One Health now that, like, although it's an evolving field, but that particular course which I recently undertook was really helpful, and it was designed by some of the best leaders, both clinical and professional, for One Health. So definitely, and these are all available online. The trick is to stay active and like actively look out for these. And like ma'am said, most of them are available at no cost. But even if they cost something, it's a very good investment to hone your skills and make yourself relevant in the job market.